According to the latest data, more than 10 million Canadian women are impacted by some stage of menopause. And as October marks World Menopause Month, we wanted to shine a spotlight around mature women's health and help you make some informed decisions. With that, joining us now is Dr. Wendy Wolfman, the director of the Weston and Oborne Centre for Mature Women's Health. Dr. Wolfman, thank you so much for coming in today.
Thank you, Melanie, for inviting me.
Let's start with the stats around mature women's health. They are not great, at least with what we are seeing right now.
Right. So the problem is that half the population are women, and every woman, if she lives long enough, will go through menopause. And yet only 6% of research in Canada is being given to women.
Why is that?
Well, I think it's very complex. It started, women were only included in research trials since 1993. And that's for many reasons. There were concerns about pregnancy. And to be honest, there was discrimination, I think, against women. And for older women or post-reproductive age women, there's really this idea that women don't count, there's ageism, that we should concentrate on reproduction. And yet women live almost 40% of their lives after menopause. And we do know that there are over 700 disease conditions that are diagnosed later in women than in men. We know also that cardiovascular disease is a major killer in women, and it presents differently in women than in men. There are many other diseases of aging which accelerate in the years before menopause or the last menstrual period, such as osteoporosis, all the metabolic disorders, diabetes, heart disease, hypertension. I could go on and on. Yeah.
Yes, so given this long list, we are now in 2025. We acknowledge that mature women's health needs to be in the spotlight. And of course, your focus right now and where you work and put in all your time and efforts into a campaign and to try to change that. So what is it that you're doing?
So we had a successful campaign last year. We raised $51 million towards a Centre of Mature Women's Health. And that really speaks to the importance of this issue for Toronto, the GTA, and Canada. I'm the treasurer of the International Menopause Society, and I can say that no place in the world has anybody raised this much money. And so that is really something that we should champion about the City of Toronto and our hospital, our foundation, and the generous donors who gave the money and believed in us. So that's amazing. But the thing that we're moving on to now is research in women's health, and particularly post-reproductive women's health, because this has been lacking. And for instance, in the US, the Bill Gates and Melinda Gates Foundation gave $2 billion to women's health research.
That could go a long way.
Yeah, and so did also the Biden administration, and menopause was one of their initiatives. And even in Canada, $14 million has been given towards a National Women's Research Institute to initiate in 23 areas research in women's health. So that speaks to the importance of this issue.
Indeed, when we talk about the financial part, that is definitely tracking in the right direction. I want to just touch on this. If someone is watching right now and they feel like they don't have the resources to, now that we have it at our fingertips, a lot of people go online and they look for answers that way. You're shaking your head saying, please don't do that. What do you recommend for anyone when it comes to advocating for their health?
Well, first of all, I think it's great that they're doing that. And I think it's important that they validate their symptoms that they're having around menopause, because in the past, all these symptoms were trivialized. Where this area was ignored for so long, now it's just blossoming. And what happens is people want to make money from it. So there's a lot of people online, there's a lot of influencers who are going online providing non-evidence-based information and making money because women are vulnerable to try and alleviate their symptoms.
They're looking for an easy fix.
They're looking for
Yeah.
an easy fix. And unfortunately, I would say that the universities, in terms of education of medical professionals, haven't kept up with the importance of this issue. They haven't recognized it and haven't really emphasized it in the curricula, both in the undergraduate area and in the postgraduate area. It's getting better, and lots of things are changing, and that's because of the swell of women themselves who are demanding the change. For instance, the Menopause Foundation of Canada, that is an advocacy group, a nonprofit, who are trying to do advocacy at the government level. That's just one example, but I can give you some validated, good, evidence-based sources for people. There are many.
What we'll do, Dr. Wolfman,
Yeah.
is we'll put the website. What's the website for your center that we can put it up and share with our City News 24/7 viewers?
Okay, so it's, I think, Mount Sinai Women's Health.ca.
Okay.
There's also the Canadian Menopause Society. There's a hub for the Society of Obstetricians and Gynecologists of Canada. There's the International Menopause Society, and they have a site purely for women themselves. That's Menopause Info. And then there's also the Menopause Society, www.menopause.org.
Okay, a lot of great, credible
Great
resources there.
sources, and MQ6, which was a site initiated by Susan Goldstein, who's a Canadian doctor also. So I think there's a lot that's going on, that you can get reputable information.
Okay, good. We could talk for days,
Yes,
Dr. Wolfman, but
yeah.
appreciate you taking this time with us.
Yeah.
Thank you so much.
Yeah, okay, thank you.